rise of cancer cases in the developing world will be a major healthcare problem as we move forward. We have lived a demographic transition through which low and middle income countries actually now have most of their deaths secondary to non-communicable diseases, and cancer is certainly one of the most important. We do see a number of risk factors that bring that forward. We see tobacco smoking in places like China. We see urbanization around the world, and all of those risk factors associated with it lead to a much larger incidence of cancer. So we expect that by 2050, we're going to have 60 to 75% of deaths from cancer in low and middle income countries. So this is definitely a major healthcare problem that we need to start addressing now. Accurate cancer diagnosis is paramount for us to be able to fight the epidemics that we're facing, and that starts usually with imaging studies for patients who do and who do not have symptoms, and this is where our study on implementation of CT PET scans in low and middle income countries becomes important. The main challenges are financial and human resources for the implementation of CT PET scans in the diagnosis and staging of cancer in low and middle income countries. We have a number of indications for which the International Atomic Energy Agency believes that PET CT scans are indicated and appropriate, and unfortunately only a small minority of patients in low and middle income countries have access to these new diagnostic and staging technologies. In high-income countries, CT PET scans have been shown to be cost-effective in a number of situations, mostly because they do help us prevent procedures that would be non-effective and would lead to more costs and toxicity. So, for instance, PET CT scans in lung cancer help us prevent thoracotomies that would have specific costs in both dollar or other currency terms, as well as toxicity for patients.